have you here and also welcome you to the Glendale City Hall. And without further ado, let's get our program underway. And the first thing we always do is recite the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'd like to introduce our first speaker. It's Representative Rick Stream, who represents Glendale now in his final term in the State House, House of Representatives. And he's done a terrific job. He's now heading up the budget, is that correct? And very important committee assignment. And we're very pleased to have him here to tell us about the last legislative session and of course, the most recent veto session. So I'd like to extend a warm welcome to Rick Stream.
Well, I will be brief because I know that the main speaker is going to talk about Obamacare. Thanks, Rich, for the comments. By Constitution, we have a veto session in September, and we take up any bills that the governor has vetoed. This year, he vetoed 29 regular bills and 4 budget lines. In Missouri, the governor has line item veto, as opposed to how it works in Congress. So there were, we had a lot of work to take up or to consider, I should say. In the past, the history of the state, of course, began in 1821. Only 8 times had a governor had his veto overridden in the era of 2/3. There was a while there where they only required simple majority, and those were like divorce vetoes, which I'm not quite sure. Somebody said you had to get if you got a divorce, you had to go through the government to get it approved or something like that. Not sure exactly how that worked. But anyway, that was only required a simple majority, but only 8 times were vetoes overridden, and it was 2/3. This year, we overrode the governor 10 times. So in 1 year, we overrode the governor more than the entire history of the state combined. Now I'll go through some of those bills. The first was on House Bill 19, which was my bill, a capital improvements bill. He had vetoed $1 million that we had appropriated to help rebuild a school in Lincoln and Pike County that had burned down a couple of years ago. They had some insurance money, but they didn't have enough money. This is a technical school that had been built in the 70s. So they needed more money. Chris Kelly, the ranking Democrat on the budget committee, had proposed it originally. We put it in the budget. The governor vetoed it. And Chris introduced the override on the floor, and we overrode the governor on that bill. Then the governor immediately then withheld the money. So they're still not going to get their money. House Bill 278 basically allowed citizens of the state to celebrate any public holidays on private as well as public lands. Federal holidays such as Independence Day, Thanksgiving, and Christmas. House Bill 329 increased fees that some creditors may charge customers. It also tightened up some of the banking regulations. And it was considered, and then we also had protection in there for citizens on funeral trusts. House Bill 339 basically was to pay for the you had to pay before you could play on automobile insurance. If you were in Missouri, of course, you're required to have insurance to drive. Some people drive without insurance. They would get in accidents that were not their fault, but then they would not only try to recover the damages of the accident, like for health and their automobile and other property damage, but they would get damages for pain and suffering and stuff like that. So we basically eliminated those damages We allowed them to continue to get the damages that they would get for personal injuries and things like that, but not the pain and suffering. So we overrode the governor on that one. House Bill 650 was the Bill Run Company bill. That particular one, which was supported by Republicans and Democrats from certainly down in that area. Bill Run was the company that had bought the mine operation 30 years ago. They're engaged in the cleanup right now. They spent $40 to $50 million on the cleanup. The mine hasn't operated in 60 years, but there's these slag heaps down there that people are suing now for injuries and health injuries. And they took the lawsuits up to St. Louis, where they would get a much more favorable jury. We said that they capped the damage awards at $2.5 million. They employ about 1,500 people down in that mine. They had down in that company, which is still cleaning up. And this would have, if they had not put on the caps, the company would likely have gone out of business. House Bill 1035 made some changes to political subdivisions that affected property taxes. Basically, we're trying to ensure that people can have a vote on property taxes and roll back the rate ceilings when it's appropriate. Senate Bill 9 was basically the agriculture protection law. Agriculture is the #1 industry in Missouri, followed closely by tourism. But agriculture is a big deal, and this bill was basically to protect the agriculture industry from essentially one organization, and that's the Humane Society of the United States, which is, in my estimation, misnamed. And they're not concerned about dogs and cats. They collect hundreds of millions of dollars with those commercials, and they are the largest euthanizer of dogs and cats in the country by far. Senate Bill 110 established child custody and visitation rights for deploying military personnel. Senate Bill 129 was a bill that we passed and overrode the governor's veto on that would allow medical personnel who voluntarily come into the state to help in emergencies like the Joplin tornado. They come into our state, they're not from our state where they're licensed, they come in from other states, they're licensed in other states. They come into our state to help, volunteer, they're not charging anything. And we have had, under the existing law before this one was passed and overridden, they were not allowed to work in our state, to volunteer in our state. So we took care of that. Senate Bill 170 was a bill by a Democrat in the Senate that was passed. Maria Chappelle-Nadal, Senate State Senator from the San Luis area, and it allowed for video teleconferencing of meetings, board meetings, city council meetings, or school board meetings, and then if somebody were not there, they could vote in abstention through those meetings. It doesn't apply to the legislature. We have to be at our desk and push the button ourselves. That was an interesting debate on that one, because a lot of people, like I was on a school board for 12 years, and if you miss 3 meetings in a row, you're off the board. I don't know what the rule is here in Glendale if you miss meetings, but it's pretty tight in a lot of these areas. But this allows the boards and councils to make the change if they want. It doesn't require them to do that. So those are the bills that we overrode. The 2 big ones that got all the publicity didn't override were the tax cut bill and the gun bill. The tax cut bill, House Bill 253, was a tax cut, across the board tax cut for individuals and businesses. It would have been phased in over 5 or 10 years, depending on which one of the 3 taxes we were talking about. And would have only gone into effect incrementally if we had raised $100 million in revenue from the previous year. The governor vetoed it, and then went on a statewide barn storming tour to basically demagogue the issue, in my opinion, because we had added a lot of money for education in our budget. We'd added a lot of money for mental health. We'd added a lot of money for special needs programs, provider rates for Medicaid providers and special needs providers. The governor withheld all of that money, nearly $200 million, and plus another $200 million, and said it was because of our tax bill. And you're basing that on the passage of a federal law, the Marketplace Fairness Act, which is the online sales tax bill, which was passed in the Senate, U.S. Senate. It's not even going to come up for a vote in the House. We checked with all of the congressmen and women up there, and we're not even going to bring it up. So it was to me, it was a false premise, a false context that he used it in. But by telling the legislators, telling the educators around the state that they were going to lose hundreds of millions of dollars if we upheld the veto, overrode the veto. The educators, superintendents, school boards, just literally pounded the legislature with messages and phone calls. And 15 of our rural Republicans basically voted against it. Now, before you get upset, I'm assuming most all of you are Republicans, before you get upset at those 15.
Not all.
Probably. That's all right. I just want to explain it. The rural Republicans, out in the rural areas, the school districts reign supreme out there. Superintendents are probably the highest paid people out there. The school district runs basically the same boundaries as the state rep district. The school district is usually the largest employer out there. So when the school district feels threatened, for whatever reason, they will call the state representative and register their complaint. And that's what happened. Most of these folks voted with us on all the other overrides, but this one particular one, because they were threatened by the school district, basically, and afraid. And I basically visited with all of them. He said, look, here are the facts. And they said, we don't really understand the facts, but if we vote against this, they guarantee that we're not going to win our next election. So I understand that. What we'll do is next January, we'll bring that bill back, we'll clean it up, take out the offending parts, the sales tax on the prescription drugs for seniors, where we used the governor's language and got into the bill, and neither one of us, neither group saw that it was actually revoking the sales tax, but that didn't go into effect in 2015. We said we would fix that this January. The other issues with the bill, we'll fix those, and we'll bring it back in what we consider to be a cleaner and more appropriate format. And we hope to do that early in the session, January, February, and we'll put it on the governor's desk. He'll then have 15 days to decide if he's going to sign it or veto it. If he doesn't do anything with it, unlike in the U.S. Congress President, it becomes a law here in Missouri. It's called, in Congress, the President gets a bill from Congress, he can sign it, veto it, or put it in his pocket, which is the same as a veto. Here in Missouri, if he doesn't act on it, it becomes a law. So if he vetoes it, then we'll have a short amount of time to override the veto while we're still in session. The other bill was the One Bill 436, and that bill, again, passed the House on an override and went to the Senate. There were problems in the Senate with the bill, and the two leading Republicans in the Senate, Ron Richard from Joplin, the floor leader, and Tom Dempsey, the president of the Senate, from the House, voted against it because, as Tom Dempsey said, if they had overridden the veto, the bill would have gone into court the next day, and it would have been a 2 to 3 year fight. He said, better to stop the bill now, come back in January, take out the offending problems with the bill, and pass a clean bill and send it to the governor. So a lot of these bills passed with pretty large bipartisan support in the House and the Senate. But when you get to a veto session, the party who has the governor, if the governor vetoes it, generally the party of the governor will change their mind and vote with the governor on these things. So We had a lot of Democratic support on a lot of these governor vetoes as well. We did get some Democrats to support us in some of the bills, so.
Sending a student to Kirkland High School. And I'm just really confused at the way they presented it. Basically, I think it's important that all children have equal opportunity to education. But that being said, everyone has to be responsible as well. So, and therein, I think, lies the problem, and not to deny any child, education. However, what really bothered me is like Kirkwood basically had no choice because of like a judge who said, okay, these schools, for whatever reason that have nothing to do with us, are no longer, accredited. So they can pick any schools they want in St. Louis and, drop their kids there. And so basically, the way I understood it, and I could be mistaken, please feel free to correct me, the people in Riverview Gardens, chose schools based on, cost per child, and also, I got the impression, the most inconvenient schools to send their children to, so that they would be less likely to move. And for whatever, Melville was one, which, that's beyond me, but it doesn't really concern me, and the other one obviously was Kirkwood. And I still never really understood why they didn't go to Hazelwood, or why they didn't go to Ladue or Clayton. And not, as I said, it seems like they had it all covered, that they were able to accommodate all these students. But still, it doesn't, it seems like it's sort of like discounts our whole system. It's like, why do we have the system we have here, the political system? But
And why do we pay the
Do you
taxes?
know
exactly, yeah.
why they pick certain
Well,
districts?
let's go back. 1993, the legislature passed a law saying that the district were uncredited. Students that lived in that district, not just the ones that went to those public schools, but private school kids, homeschool kids, could then pick a school district in the adjoining county and attend that school for free, and transportation would be paid for. That was a law that was passed in 1993, the Outstanding Schools Act, Senate Bill 380, long before any of us were there. I was on the Kirkwood School Board at the time, and we understood it, but there were no uncredited districts then. The first one that went uncredited was St. Louis Public in 2006. They were under an SAB. I could talk for an hour on this. I know Frida would come over and choke me if I did.
No, but I didn't mean to invite this, but I just.
But just in a short, and I'm on an interim committee on education. We've been traveling around the state. We had hearings in St. Charles and at Merrimack, and yesterday I was down in Cape Girardeau and Poplar Bluff. And today they were in Branson and Joplin, and next month I'll join them in Kansas City, and we'll go over to the north part of the state. Talking about all of education, but student transfer is the big issue here, and of course in Kansas City. The districts, based on interpretation of the law by DESE, and DESE is a major player in this whole thing, Department of Elementary and Secondary Education. They are interpreting the law probably differently than a lot of us would. But they are basically saying that these school districts that are unaccredited, Normandy and Riverview, can choose a school district, first, second, and third choices, where the students in these districts can go to any district. They would pay if they don't pick the one that was chosen by the school administration. Now, I talked to Todd Nichols, who's the superintendent of Norman. He just got the job July the 1st, so he's not to blame for any of this. He used to be a principal in Kirkwood. He explained it in one of our hearings, because I asked him, I said, what was the rationale you used to pick Francis Howe? And he said, well, first of all, we can't pick a district that's provisionally accredited. And he said, we can't pick a district that's not accredited with distinction. Why would we do that? So he said, where he is located, looking around, a lot of those districts, Hazelwood, Ferguson, Forest, and some of the others, are not accredited with distinction. So, and he said, we wanted to pick a district that would have enough space for our kids to go to. And he's lost about a quarter of his kids, of course, now. So that's why they kind of picked Francis Howe. He may have disagree, but he explained it that way. What's happened in his district, I will tell you, is something that nobody has reported, or we just found out 2 days ago. A lot of people have moved into his district, rented an apartment, and are now sending their kids to other school districts. So he said, we are paying, Normandy is now paying for like 300 students that didn't live in Normandy last year. So it's parents who want a better education for their kids have figured out how to game the system. Our job in the legislature is, first of all, to go back in January after we have all these hearings and try to come up with a solution to the whole problem that will take care of two issues, I think, mainly. Protect the county districts from being overrun with students more than they can take. Because right now, there's no protection. Districts, Kirkwood has taken 182, I think. Some of the other districts have taken more, some less, up to the limit that they feel like they can take. Now, they're getting paid handsomely. Kirkwood's getting $14,000 per student. The cost to Kirkwood, incremental cost to Kirkwood is nowhere near that. I went through all of this with the VTS program. You know that for 30 years we've been taking kids from the city under the VTS program. Initially, we were taking a full tuition rate for every kid that came in, and we knew at the time this is more money than we need, because we weren't even paying for transportation. But right now, under Vic, it's $7,200, which is about half of what Kirkwood's cost is per student. So Tom Williams, the superintendent, and the school board said, look, you can work out a deal so that the districts that are moving these kids don't have to pay as much to us, and Clayton's $19,000. It's anywhere between $10,000 and $19,000. So that is more appropriate. That way, the state legislature doesn't have to come up with $7 million to give to Normandy, which has been in the newspaper also. So we can remedy that. So the funding aspect, overpopulation, the overrunning of our school district, we're going to address that. And finally, we have to do something to ensure that these kids in these unaccredited districts have access to education. And that's the key. That's the key. All reform measures where they want to have checks and credits and vouchers and other things to allow these kids to go to private public schools in the neighborhoods. You can argue with or against that. I'm just saying that should be on the table for discussion. But none of the education establishment groups, the school board association, the school administrators, the teachers unions will agree to any of that stuff. But yet they've come up with no solution for 7 years that I've been up there to ensure that these kids, almost primarily all of them, are getting a quality education. Now, we can say that there's problems with the families, we all know that. But some of these schools in these districts are doing a good job with the same group of kids. Other schools are not. So it's a problem. It will take that's why we're doing this tour, to hear what the people have to say, and then we'll have to resolve it in the legislature.
Where can someone find the information about what constitutes an accredited school district?
It's on the DESE website. Department of Elementary and Secondary Education.
DESC.gov.
Go to the
DESE.gov.
I'll be around. I'll stick around.
I'm sorry. We're really very happy or glad to have Robin Hanlon here, who can talk to all of you about the healthcare legislation. And her presentation probably will run over a little bit, but you can always get up and leave if it takes too long. I thought we could start earlier, but it is what it is. I want to say one thing. The St. Louis County Central Committee is having a comedy night on October 19th. I have flyers in the back. We are looking for people to sign up for this. This is a fundraiser for the St. Louis County Central Committee. Thank you. Robin?
Didn't Charlie have a 30-second thing you wanted to announce?
Charlie, you want to say something?
Yeah, we've got a social media training that's coming out here on October 12th. That's one thing that a lot of Republicans have been asking for, is to better understand either how to use social media or how to better use social media. So we've got some flyers on the back and table if you guys are interested.
Okay, we've had a lot of changes in Obamacare, also known as PACA or ACA, depends on who you're talking to. This is going to be effective October 1st. even if it's defunded, the law is still that everyone must buy insurance effective January 1. So Frida has got some handouts that I want you all to have. Frida,
Yes.
you can't leave those back there, they have to have them in their hands.
Okay.
And the pens, bring the pens in case they don't have a pen. I've got a packet for everybody, so we can go through this and you can make notes. If you don't have a pen, Frida will give you an ink pen. To find out what you know of, how many of you have insurance right now? Okay, anybody not have insurance? Oh, good, we can scoot through pretty quick then. Everybody in here know what a deductible is?
Yeah.
That's the amount of money that you must pay before the insurance pays anything for your health care. Co-insurance, everybody knows what co-insurance is?
Yeah.
What's that?
Okay, after your, well, there's some people that think they know, they don't know. Let me back up a little bit though. What do you run out of?
There's some more over here.
Okay, go ahead.
Okay. I've been doing health insurance sales for 30 years, so we used to calculate premiums off of a piece of paper. Now you do everything computerized, so there's been a lot of changes. But in Jefferson City recently, there was a bill to expand the Medicaid system in Missouri. If they had passed that bill, the way it was written, we would have lost in Missouri our tax exempt hospitals in 2015. This is based on a report out of the U.S. Treasury stated June 2012. Tax exempt hospitals are different than nonprofit hospitals. The tax exempt hospital in our particular area is Shriners. That would be a big deal to people whether they have insurance or not. We've got people both sides of the aisle, all size, shape, color, political, whatever, that use tax exempt hospitals. If you don't have any money, you get treated. If you have insurance, they take what your insurance pays and they treat you. They treat you real well. We've got a lot of kids that have used that, so I'm glad that that part did not pass in our legislature in Missouri. Part of the thing, everybody has to have insurance. A lot of people are going to lose their insurance, and the reason is just a pure financial reason from a business standpoint. If employers don't have to pay so much out, they're not going to. Any businesses that have over 50 employees, they have to look at their financial options. They have to look at their balance sheet. They have to make plans on how their business is going to run, where their money is going to come from, and so forth. If our congressmen on both sides of the aisle will spend some time with different chambers of commerce groups, they might learn this. But they've decided they're going to do things their way, and they're better than us, and they don't have to have membership in the exchange, and we're, as the public, we're still funding their insurance when we shouldn't be. COBRA is going to be another issue. Everybody know what COBRA is?
Yeah.
Okay. Because if you work for an employer that has less than 20 employees, you didn't used to have COBRA. You had Missouri State Continuance, which was different. It was only available for 9 months. Under COBRA, you're only eligible for COBRA if you lose your employer-sponsored coverage, if that employer plan is still in force, and if the employee does not have other coverage available that does not include pre-existing conditions. So that means people will lose their COBRA coverage when this is fully implemented. Because if you work for someone and you lose your job, you leave, or they lay you off, you have other insurance coverage available that does not have a pre-existing condition under the marketplace. The problem is the network in the marketplace is very narrow. We'll go into that in a few minutes. This is basically coercion by government to push people into a plan that they have forced you to buy. I don't think the representatives of the people have considered any of the repercussions of the rules that they're allowing the bureaucrats to write to enforce PPACA. When Congress passes a law, they pass the law, they shift it off over to the bureaucrats who tend to write the rules. Nobody really oversees them. They just write the rules however they see fit. They say, this is what we have to do to enforce what you passed. Some of these things that are being pushed through and written by the IRS, Department of Housing and Urban Development, are going to be detrimental to a lot of people. A little bit back to charitable hospitals, because this is a big deal to me. We all think hospitals are a good thing, the nonprofits and the tax exempt. When hospitals fill out their Form 990, they all have to fill this tax form out that gives them tax exempt or nonprofit status. They have to show how many people in their area, their geographical area, are uninsured in order to keep their tax exempt status or their nonprofit status. If the law says that everyone must buy insurance under the Obamacare law, how many uninsured people will we potentially have in a geographical area? You should have very few. So our hospitals that are nonprofit and tax exempt are going to take a big hit on this. People that donate to them, they're not going to donate if they can't write it off on their taxes. So that's going to have another impact on our area medical care. That will discourage enrollment in Obamacare for a lot of people, because they use a nonprofit hospital or a tax exempt hospital, and if they sign up for something, they're gonna lose their care.
So have the bureaucracy people come out and said that these organizations would lose their tax exempt?
Yeah, you can pull up, I might have a copy of the Form 990 with me.
I understand the 990, I just don't
But it
understand.
was in the report in July of 2012 from the Treasury regarding their tax exempt status. It really focused on the tax exempt status of hospitals, and they changed the wording in the form to say medically indigent. So they have to define how many medically indigent people there are in that geographical area. Medically indigent means you don't have access to health insurance. That's the definition in their rules. So, and it's a big circle where they're just going to try to really turn these, they have to turn them into for-profit hospitals, basically.
Well, what are they saying that this geographic area is? How big is it?
It's whatever, when they file their corporation papers and so forth, and what the IRS allows them. Because the IRS is the sole decider of their geographical area and their nonprofit or tax exempt
If you
status.
take that Shriners Hospital up here,
That's a big geographical
well,
area.
it goes down into Texas and Oklahoma, New Mexico, and Colorado. I know people who have come.
Right, but that's not their geographical area.
Okay.
There are people that have came here, but there's people from here that go to Mayo Clinic.
Okay.
Okay, but it would be Missouri, Illinois, this geographical area, people they serve.
Well,
They're-
what
they're
happens
big
to these
section.
people that don't sign up for Obamacare? That don't have insurance now, and they do not sign up for Obamacare? They say they're gonna get fined, right?
Yeah, well, we're gonna get to that.
Okay, all right.
All right. I've given you a copy of everything that I'm gonna talk about, yes, sir.
I think ACA is Affordable Care Act, but I'm not sure what PP is.
It's the Patient Protection and Affordable Care Act.
Patient protection.
And this whole bill was not just one bill they passed in Congress, it was actually two bills. And most people don't realize that. The second bill was passed a couple days later. I talked about the community needs assessment. All right, so there's basic insurance terminology to learn them on this page. Because most of you in here have insurance, I think everybody in here has insurance, and I'm gonna go over these really quickly, so we don't run over on our time. A navigator and an agent, insurance agent. This is a big deal, you've heard a lot about navigators. All these navigators that they're training. Navigators cannot sell you insurance, they can only navigate you to sign up for the government mandated plan. So it's important that people learn the difference, that they don't have to use a navigator to get insurance. They might be better served to call up their insurance agent. If your insurance agent is not doing their job, they haven't been learning all this. But it's important that they've passed all the tests. An insurance agent has to have continuing education credits. Every year, they have to take new training, additional training, they have to pass tests, they have to have errors and omissions coverage, they have to have liability coverage. Navigators do not have to have that. So there's a big issue with identity theft that people are discussing. You want to make sure that anybody you know that changes their insurance or wants to know about the difference, tell them to go to an insurance agent that is licensed. as opposed to a navigator. They get the same benefits, but their personal information is a little bit more protected that way.
Do you have a navigator in? I don't see a navigator.
No,
Was not there.
it's not in there. No, I did not put navigator in there. Yes, sir.
Just quickly, I heard that a navigator has to fit the demographic profile of the area they're representing. I just heard that on the news.
Yeah, you can hear a lot of things on the news.
That's not true.
No, that's not true.
But they are IRS agents in essence. the
No,
navigators.
no, they're not IRS
Oh.
agents. They are not part of the demographic area. Anybody that wants to be a navigator or any community organization can say they want to train some people to be navigators. And they have to take a test. I had to take this little test that they have to take. They're not going to, they don't have to learn much to pass this test. It takes about 2 hours to go through the web screens and the multiple choice answers on the screen. And if they pass that, then they're certified to be able to navigate people through the new health insurance marketplace.
Why would they want to be a navigator?
Make money.
It's a job.
Who
How
pays
much
them?
who
You
pays
do.
that?
People up to the Democrats.
It's taxpayer money that pays them.
So what department are they going to be under? I mean, who they?
Health and Human Services.
So we're going to get ready to see a big spike in new,
We've already given out $62 million to different organizations to sign them up. Okay, some of the other things, everybody in here know what benefit levels are? That means the level of benefits you get with different insurance plans. Does everybody know what brand names drugs are? Formulary drugs, non-formulary, and generic?
Who interprets those? Each insurance company has their own,
Right.
their own
Each insurance
list.
company has their own formulary. If you're over 65, you should know it because you had to choose Medicare Part D. If you're under 65, you may not know the difference, and each insurance company has a different formulary. Anthem might have a formulary for 15 blood pressure drugs. United Healthcare may have a formulary for 25 of them. That's because that insurance company has gone to that manufacturer and said, we have this many people that take this drug. And if you want us to send our people to buy your drugs, you want to be on our list, you're going to give us a deal. You're going to cut the price of it. And so each insurance carrier will have a different formulary. So that is a very big deal for a lot of people. That's something that you need to look out for if you take a lot of prescriptions.
And they can be changed at any time, so you can
Once a
sign
year,
up.
once a year.
Still.
No, as an individual, you can only choose once a year, but the insurance companies can change their formulary
Yeah, I
at
don't
any
see
time.
No,
They can't?
no.
No.
Well, I was told that they
Who
could.
told you that? They have a contract. It is just like any other contract. It's just like your contract for your premiums. In the state of Missouri, when you buy insurance, your premiums are guaranteed for 12 months. If you change age brackets, if you change from 29 to 30, your premium can change. But your premium table did not change. You stay on that same table for 12 months. So the formularies are changed once a year. A lot of people don't read that stuff that comes with their prescriptions. This is going to be important that you look at those receipts because there's going to be information on those regarding if you can continue taking that drug or if you need to go to the doctor and get what's called pre-certification or pre-authorization. You all know what pre-authorization is for that?
Yeah.
If you don't know what that is, there are certain drugs that your insurance carrier would like for you to, instead of taking that purple pill, we all know what the purple pill is, that's Nexium, they want you to take some other antacid before that to see if it works. It's called a step drug. So you have to have prior authorization in order for the pharmacy to fill it. Most of the insurance carriers will fill it for the first month, but in all those papers they give you when you pick up your drugs, there'll be 1 or 2 sentences that says, be sure to talk to your doctor before you come to refill this. Because otherwise you go to refill it and they won't fill it. Then you get all up in arms because your insurance doesn't cover something. You have to pay attention and read this. You have to be educated on it. Brand name drugs are a big deal. They want you to use generics whenever possible. Sometimes that doesn't work out for everybody. A lot of people don't know what brand name drugs are. And it's just on their formulary list. That's the original drug. That's Prairie Farms milk versus Casey's. It's brand names. Case managers and case management, do you all know what that is?
Yeah.
Everybody raise your hand if you know what that is. Okay, that is when you have, say you're diabetic and you're overweight, you will have a case manager. After you go to the doctor, whether you know it or not, you have one. These are going to become more and more important under the Obamacare plans because they have to control the cost. In order to control the cost, somebody has to watch to make sure that you refill your prescriptions, your insulin. You are doing what's required with your blood sugar levels. You're taking this or you're taking that, and they'll try to get you into some other program. So you will have more case managers and case management. They will call you on the phone to make sure that you've done things. You're going to be micromanaged in certain things if you have asthma or if you have some condition that carries on and on. Yes, ma'am.
Are those case managers, we had a situation where a nurse from our insurance company tried to call us and ask for him to answer questions pertaining to his treatment regimens and what have you, and we just basically said, you know what, we're not comfortable, and we had called the HR department at his company, and they said, you're not comfortable. So
Right.
my question is that mandatory?
That
you
is
inform
not
these case
mandatory.
managers? Okay, so
Under
they're gonna
private
ask, but you don't
sector
have to.
plans.
Hmm?
That's not mandatory under private sector plans. Okay.
Does that put you on a blacklist at that point?
No, no, it just says you don't want people intruding in your,
Well, you know, this is not new. The good insurance companies right now are working with their insured clients. If they have an issue, they call it a health management thing.
Right.
And they've got registered nurses.
right, because they want you to get better.
Right.
And if you get better faster, that saves money. It's healthier for you. Sometimes you're doing everything right, you don't need somebody looking over your shoulder. And so in the private sector plans, you're still gonna have these, but not so much as you will in the new government insurance plan. Okay? We have something new coming. Everybody that has insurance, you know how your premiums work. They go up every year. You get older, premiums cost more. Things are going to what's called community rating. In the state of Missouri, the laws have been that if someone was in their early 20s, the premium charged to someone in their early 60s could not be more than 5 times more than what was charged to someone in their early 20s. Under the new rules with PPACA, it's 3 to 1. So somebody who's 64 cannot be charged more than 3 times what somebody who's 21 is charged. And instead of having, currently we have age bands. When you buy insurance, if you're between 45 and 49, your premium, everybody between 45 and 49, the premium's the same. 50 to 54, the premium is the same. Under the new rules, everybody's premium will be different at every age. It will go up incrementally every single year. There will be no more age bands. So that's so that they can squash everybody to the middle a little bit more for premiums. And a lot of people are going to notice that pretty quickly. Also, you have no difference if you're male or female. Currently, all females, they know we're charged more because we have babies. Men don't. The premiums for males have traditionally been lower. Young males, really cheap. The young female, really high. That is going away. It doesn't matter if you're a male or a female. So what that's going to do is going to keep the premiums up for the young males because they have to basically spread the maternity risk out to them. That's great from a female standpoint. But that's bad for them because they're not accustomed to paying this. It was hard to get them to buy insurance before, and now they're really not going to be happy. But the premiums for some of the older people are going to come down because they can't be charged more than 3 times the premium of the younger people. So people who are in their 50s may see their premiums go down a little bit, not much.
Robin, I'm sorry,
Yeah.
but is that true whether you're in the private or the public exchange?
That is true whether you're in the private or public exchange. This will not happen on everybody's plan overnight. There are a lot of people who want to keep their current plan because their out-of-pocket maximum is currently low. They might have a $2,000 out-of-pocket maximum after their co-insurance. On the new plans, the out-of-pocket maximum is $3,600. And that's after a $3,000 deductible. You all know what copays are.
But those don't go in,
Pardon?
those don't compute for your co-insurance.
No, they do not count towards your co-insurance.
Okay.
That is what you pay when you, if your plan has a copay, what you pay when you go to the doctor.
Right.
Under the new insurance plans that everybody's talking about, the government insurance plans, they stress that there is no copay for preventive care. And that tended to kick the premium up over the last year. 13% of the premium increases were due to colonoscopies being covered as a preventive care service. Those are $4,000 to $7,000. So, of course, it had to kick premiums up. It would be like if you added oil changes to your car insurance. What would happen to your premiums? They would go up. And that's kind of what happened with the health insurance. Cost sharing. President Obama kept talking about a lot of this all for 2 years. Cost sharing. Everybody's going to share part of their cost. Well, now it's coming home to roost, and people are finding out what cost sharing means. That means you pay 30% of your bills, and the insurance company pays 70%. Or if you're on an 80-20 plan, you pay 20%, the insurance pays 80%. Some people are on 90% plans. I tend to sell 90% and 100% plans. So if you've got a 100% plan, that means after your deductible, the insurance pays everything 100%. You don't pay anything. On a 90% plan, you pay 10%, the insurance pays 90%. You have to use their providers though. You have to use doctors that are in the network. Because if you go outside of the network, you know, they give you a list of doctors, it's online. You used to get a book once or twice, once a year, once every other year of all the providers. If you go to a doctor not in your network, it's not going to be covered at the same amount as in network. So your out-of-pocket costs are going to be higher, and that does not apply to your out-of-pocket maximum.
So you have to ask every doctor you see, are you in the United Health?
Well, you should always, well,
Yeah.
you know,
And they'll ask you for your insurance card, the
Right.
assumption is they take that insurance, but you don't know if they're in or out of network.
United Healthcare in this area, United Healthcare in Coventry, just about everybody's in there. With Anthem, some of their plans are changing January 1. So they're gonna let, a lot of hospitals are not gonna be in there, but we talked about drug formularies and deductibles. And explanations of benefits, you all know what those are? Everybody in here's ever gotten one, right? Anybody never gotten one? Okay, when you go to the doctor, you have a contract with your insurance company, whether you have it or if your employer has it. When they provide a service, they have to give you a piece of paper that shows your bill was $7,800. The negotiated rate for that service was $4,000. Of that $4,000, you had a $500 deductible you had to pay. And then after that, we paid 30% of the balance and you owe 20%. That's called an explanation of benefits. They explained your benefits to you on a piece of paper. And they mailed it to you or emailed it to you.
After the fact.
Well, yeah, it has to be after the fact. Because they don't know what your bills are until after you've incurred them. Just like if you have damage to your house, they can't give you an explanation of that claim check that they gave you until after the damage was assessed. So it works the same way.
I don't understand that though. If you go in for a colonoscopy, you should be able to say, what do you charge for a colonoscopy?
Yeah, you can.
And they will always tell you, we don't know, it depends on your insurance.
Exactly, because they have negotiated rates.
No.
Well, but even besides that, they'll say, we don't know, the person who, there's only one person in this hospital that has that information, and when you make more calls, you find out that person is perpetually on vacation. So
Well,
you
they
can
don't want to
never
tell you
find-
that, and that's part of the problem with the prices of healthcare. They're not transparent. Because United Healthcare has negotiated a steeper discount for a colonoscopy at Mercy than Anthem has. Or Anthem may have negotiated a deeper discount at Barnes. So there's no way for them to know all the time. And those contracts do come up it's transparent, it's not transparent to you, it's behind the scenes. You don't know the dates of those contract renewals. And they are all year long, every single day. Because every condition, every blood draw, every broken leg, every x-ray, everything they do is negotiated.
Okay, does Obamacare fix any of this?
Nope, we're gonna go back. I just got the new stuff, new flyers for it.
Before you go in, I'm totally baffled here. Do you have any idea right now, let's say in St. Louis County, what percentage of people are not insured?
Nope,
Would you guess? I mean, you're in the business. Is over half of St. Louis County insured? You think?
yeah,
You think 75%?
I don't know.
Okay, let's just assume it's 75%. If this 25% that's uninsured, for argument's sake, signs up because they don't want to be fined, you're going to increase the number of patients that are seeing doctors, maybe not by 25%, because a bunch of them are getting free anyway, but there's a lot of people going to start going to doctors that haven't been going to doctors. This system is going to absolutely self-destruct.
Yeah, it's gonna be interesting.
What?
That's what they want.
Everybody has an insurance ID card. Every time you buy a health insurance, you get an ID card.
Right.
Right.
How many people in here were against a national ID card?
What do you mean national?
I wasn't.
Well, we're going to have, basically, because you're mandated to have insurance,
Oh, I
the insurance company is mandated to turn that information over to the IRS and Health and Human Services. So essentially, you're going to get a national ID card.
Clever. That's how they do it. The reason they want this to fail is because they want single payer. Everything's covered all the time, no insurance, the government pays everything.
What?
That's the goal.
Oh, yeah.
The goal of Obamacare is to destroy the system?
Yeah.
And in so then we have Medicaid for the people who are very poor and there's no way that they can buy health insurance. Sure, they can go to free clinics and get charity care, but if they have something major, they have Medicaid that they can apply for and have that. And Medicaid is basically a medical benefits program administered by the states, subsidized by the federal government. Under this plan, the states decide what expenses will be paid for those who qualify. These are called Title 19 benefits. Medicaid is different than Medicare. I talk to people all the time. They will tell me, oh, I'm on disability. You get to talk to them. They're not on disability, they're on SSI. Oh, I've had Medicaid for 5 years. They're not on Medicaid, they're not on Medicare, they're on Medicaid. Because the names are so similar, and we have very few people that control the media. People think these names are interchangeable. They are very, very different. The benefits are different. What they can do with them are very different. With Obamacare, a lot of people don't know what they have. I have talked to a lady today. She's adamant she has Obamacare. She got a card. Obama sent her an insurance card. She has an insurance card, and she gets to go to the doctor for $2. She doesn't have Obamacare. She's got a card for People's Health Center. That's not Obamacare, but she's adamant that it's free and it's Obamacare, and Obama gave this to her. I think reality is going to really slap her in a couple of months.
Did you talk to her on a free cell phone?
No, I talked to her. Medically necessary is something that everybody needs to know what that means. Medically necessary is a treatment that is absolutely necessary in treating a patient. There are things that are coming down from the federal government defining medically necessary for different age groups and different demographics, depending on your age, the part of the country you live in, how to treat children, what they should be treated for, what they shouldn't be treated for. I don't know if any of you remember the talk about mammograms. They were talking about maybe that really wasn't medically necessary, that females had that done as often. That saved a lot of lives, but that is no longer considered medically necessary the way that we used to have them done every year. So there are going to be things cut that people don't notice right away that you won't have coverage for. I'm just picking some of these as we go through because you can read them at your own leisure. Some of the things that I think are very important. Yes, ma'am.
The stipulations for one applying or receiving Medicaid, because they have, now there's all of these other options, will those change? Because, you know, they're.
If you're eligible for Medicaid, you're not eligible for Obamacare.
No, but are the stipulations for Medicaid going to change? Because they're pretty open. I mean.
So anybody over 65 is not eligible for Medicare?
No,
I mean, not eligible
Medicaid,
for
anyone
Medicaid.
can get Medicaid.
No, not anyone can get Medicaid.
Well, no, but you,
Any
if
age
you don't,
group.
yeah, any age group. But if you don't have an income, you theoretically can get Medicaid.
Right.
Now, are the stipulations for that going to change? Like, well, you have the potential to get an income. There's no reason why you can't have an income.
No, doesn't look like that.
So, like,
Makes sense though.
yeah, like, so some of these people are like, oh, well, gosh, I don't feel like paying for health insurance, so maybe I'll just, like, go into, you know, do a little, like, finagling with my finances, quit my job, and then I can get
To be
Medicaid.
eligible for Medicaid, they have to have less than $8,000 a year. So if they can live on that, I guess. There will be tweaks done to it. A lot of states have passed the Medicaid expansion. Missouri did not. Yes, sir.
So going back to medical necessary, my contract will spell that out, will it not?
Yeah,
So
It
each
will
year
be.
when I get a new medical insurance, I will know what's covered and not what's not,
No.
based on my age.
no,
How can you make a decision?
because there are thousands of.
I understand.
But they will define, it will cover what's medically necessary. And then there will be a definition in the back for what's medically necessary, because,
So they won't tell me what procedures will not be covered.
no, because,
You're just saying to get ready for it, that this is going to happen.
but you're never going to see a list of medically necessary procedures.
But
Because
you
what
said-
would be
but you-
medically necessary for you might not be medically necessary for him.
But you said they were going to do it by age group.
There are suggested medically necessary, and you can see those, that's public records. I can send you the link for that afterwards,
Okay.
Jimmy, and I'll send it to you. I posted it up on Facebook, I've sent it out to
Okay.
several groups.
Facebook on your name?
Yeah,
Okay.
you'll have to dig down far, because I posted it. Just email me.
Well, I got your email.
All right. Out-of-pocket maximums. We went over those, so everybody knows what those are. So now I'm gonna give you a brief, let me see.
But you said the maximum is not really a maximum if you go out of network.
Right, your maximum out-of-pocket is your in-network maximum out-of-pocket. Your out-of-network maximum out-of-pocket is always different. Generally double or more. Yes, sir.
You skipped over Medicare in your health and
Ah.
protection. I'm on Medicare, and I'm not too unhappy with it right now.
Well,
Will
I'm
I have
sure
any
you're not.
changes with the PP, ACA, now that I know what that means? Will that affect my Medicare coverage at all?
Not yet.
You say not yet.
Right, because they're looking at taking away the Advantage plans.
I don't have the Advantage plan.
Medicaid, well, a lot of people have Medicare Advantage.
Oh,
Every year Medicare changes, the deductible for inpatient hospital goes up.
yeah.
The cost for your Medicare supplement goes up. But what most people don't understand about Medicare, you get a social security check, right?
Yes,
Some money comes out of your social security check for Medicare.
yes.
And what portion of Medicare does that cover? You think it's A and B?
It covers a part of B,
Covers a part of B.
yes.
All of your Part A benefits are covered by workers,
Yes.
current workers. So what comes out of your check and what you pay for your Medicare supplement only covers about 40% of the actual cost of your.
I understand how Medicare works. My question was, will the PP, ACA change that? And
Not the first year, but there are tweaks that they've looked at It changes. There are still 1,200 sections of the Affordable Care Act that are to be determined, and they are to be determined by one person, the head of the Health and Human Services, which is Kathleen Sebelius. So we still have a lot of unknown things. When you read the bill, there's a lot of things to be determined, to be determined. As of last Tuesday, there were still 1,200 of those.
So it's possible.
Yes.
Her
This
staff.
is a moving target. It
Her and her
changes.
staff are gonna figure it out.
Yeah, yes, sir.
I'm on Medicare and I have VA benefits. How will that affect me?
It's not gonna affect you much right now. This is basically affecting the people under 65 right now.
There is insurance.
Would you take a break right here and explain to what's gonna happen to these uninsured people?
Yeah.
That don't sign up for this? They're gonna get fined, I
Yeah,
understand?
that's the next page.
Well, I'm just pointing out.
Okay,
Your plan.
the plans in the exchanges, people that want to go buy government-funded insurance, because they're gonna be mandated to buy insurance. They have metallic names. You have a bronze plan, a silver plan, a gold plan, and a platinum plan. In Missouri, we have one insurance company that has decided to sell insurance in the marketplace, and it is Anthem. And they are not selling the platinum plan. So that's the best plan. They're selling the bronze, the silver, and the gold. All of the subsidies are based on the silver plan, which is a 70% co-insurance plan. All of the subsidies are based on the $3,000 deductible plan. So someone who doesn't have insurance and they can't afford to buy private insurance, if they go to the marketplace, they're gonna buy a plan that's a $3,000 deductible, 70% co-insurance, with a maximum out of pocket, after the deductible, $3,600. They're not gonna be able to afford that.
Not if they use it.
And this is going to make a lot of people very unhappy when they find out they have to pay for this. I talked to a truck driver 2 days ago. He says he makes $40,000 a year. He's never had insurance. He really wanted Obama to have a second term. He wanted this health insurance thing passed. He got really angry with me. His insurance is gonna cost him $316 a month. He says, I can't afford that.
Just for him?
Yeah,
Too bad.
I'm sorry, that,
That's what you voted for.
I'm the messenger here, you can't yell at me. But he was, 2 days we've argued, he yelled at me today.
How old a man is he?
He's 52, yes.
Where's the tax breaks come in?
Yeah, it's
There's tax breaks that this individual is going to get.
subsidies.
Subsidies. What
$30,
do you mean 30 bucks?
that's it.
Because he makes 40,000 a
Right.
year.
Right, there you go. So you only get subsidies if you're really low income, like you're in that.
That's not the way they sold it.
No. Well.
And that's also not the way they're talking about it now either.
Okay, let's target one group of young people, since it looks like most of the uninsured people in this country.
In Missouri, if you make $9 an hour and you work 40 hours a week, you're gonna get a subsidy and you're gonna pay $71.91 a month for insurance. For this $3,000 deductible plan.
That's if you work 40 hours.
Right, and the government is going to pay $2,143 to the insurance company for you.
That's-
Let me ask you, let me go the other, I think I just read it today, that you're eligible for a subsidy if you make as much as $62,000.
Correct.
What do you get then if you're making $62,000?
That's still a moving target. There's a calculator that you can get on, kff.org. There is a subsidy calculator. If you go to healthcare.gov, you will see that. They refer to the Kaiser Family Foundation calculator to get an idea of what the subsidies are.
KFF?
Yes.
Now, I got a question. My son lives in Philadelphia. Is all this still pertain to him, or is it,
Yep.
so it won't make any difference whether,
Oh, actually, no, it will be different.
The states are different.
Every state will be different because your demographics are different. The federal government is handling the exchanges in some states.
Yeah.
Some states have elected to set up their own state exchange, so their benefits are different and their rules are different, how people enroll are different, the benefits are different. Some have a partnership. And so the federal government is running the exchanges in most of the states.
So basically, you go through your state if you want Obamacare. free your own state.
Well, you get it from the state you live in.
You call,
That's what I meant.
you call an insurance agent, or you go to a navigator and buy it. And you're best to go to an insurance agent because they can look at everything in the market for you. And in some cases, the new insurance is not the best thing. Yes, sir.
Did you say that Anthem is the only one offering a plan?
Anthem is the only one in the state of Missouri, because they're mandated by law, they have a 20% market share. This is the new flyer for the plans, the marketplace plans in Missouri. I just got this at the meeting.
That's Blue Cross Blue Shield.
It's the only one, yeah,
Oh, that Anthem?
yeah.
Yeah.
Oh, okay.
You're saying the marketplace for Missouri only has one,
Insurance company in it.
that's
Yep,
it?
that's it.
Do you see that changing?
Nope.
Anyways,
I thought I heard
I thought-
33 on the news today.
What state?
Missouri.
No.
The news.
What news station are you listening to?
There were like 111 in Illinois, and there were like 33 in Missouri.
That might be the I'm still confused about the lingo. So when you say a marketplace plan,
Okay, the
you mean the
marketplace
public exchange?
is the public exchange. And when that was sold to us, basically what we have done is we've allowed our government to become a business. We've allowed our government to become an insurance company, own a business, an insurance company. We are funding it for them. What a deal. You know, they're gonna get to sell something that the people that don't sign up for their product are going to subsidize for the people that do buy it. And it's called the marketplace. They had to call it the marketplace. It was called the exchange originally. They cannot call it the exchange because there was no word in the Spanish language for exchange. No, I'm serious. This is the reason it was changed. In the bill, it was listed as exchange, and the IRS changed it to marketplace. So it is the marketplace. If you buy the marketplace plan, you're going to be buying a plan from Anthem, and you're gonna pick one of these, and there'll be one, that one right there is the one that the subsidies are based on. People are not going to be happy. Then, in order to keep the premiums down, the provider network, we talked about the in-network and out-of-network providers. The provider network for the marketplace plan is very narrow. It does not include UJC. There are very few hospitals. The list of providers is very small. They put in just the minimum required by the Affordable Care Act. There are some counties in Missouri who do not have an in-network hospital.
Wow.
This was approved by the federal government. This is the plan that they set up. They knew in order to keep the premiums low, you had to squash the people down to a certain segment. You had, in order to do that, you had to take out the providers. You had to get them down to something that they could control to keep the premiums down. So what will happen if there are only 15 pediatricians in your area and there are 700 new people, they're not gonna get in the same day or the next day. Not if there's some bug going around, because that doctor is going to be seeing other patients also. And they've had to agree to accept lower negotiated rates. We talked about negotiated rates. Those doctors had to agree to accept a low negotiated rates. So a lot of them may take your copay, and then the insurance will pay them $25, and that's what they get. So if they get $55 for an office visit, that's what it is. Yes.
It sounds like those states that chose to handle their own marketplaces had many people apply. There's been a lot of options, and that's kept the prices down. It sounds like Missouri.
Which state?
Texas.
California.
Oh,
It
Texas.
sounds like.
California's rates didn't go down.
Yes, the ones in the marketplace did.
They went down from what? From what they were originally projected?
Yes.
From what they were originally
In
projected?
Missouri opted not to take part in this, and so we're getting the federally run marketplace, and now we're complaining because we don't have as many options as the other states do.
California is, their rates did not go down.
They did.
They went down from the projected original rates.
Yes.
If you look, I'll send you the link of the current rates, pre-CAPACA and after CAPACA rates. They did not go down. I'm not sure where you got that information. They've gone down in a couple of states, a couple of sections of New York, and in Vermont.
Yeah.
and one of the other states, Rhode Island or
My
something.
daughter lives in New York, and so she's gonna take advantage of that as well.
Well, yeah, New York has had a different rating system all along,
Their insurance, I think so.
but California's rates did not go down. I'm not sure where you got that.
Well, that was part of the fuzzy math that they were using. They being the federal government saying that it's gone down from the projected what it was. gonna
Right,
be.
they all have gone down
It
from the
didn't really go down
projected.
to what they really are now.
Every premium across the country has gone down from
So even in
projected.
Missouri, even these anthem
Gone
rates,
down from projected does not mean gone down from actual.
even the anthem rates are below what they were expected.
Yeah, the rates are going to go up January 1.
But not as much as originally anticipated.
Right, that's what
So
she's
going
saying.
up 195%, they might only go up 165%.
Are they going up that much
Yes,
in Missouri
yes.
with this plan?
Some of them are,
Oh, some of them are.
yeah. So,
Death doesn't seem like such a bad option anymore.
What doesn't?
Death.
okay, then, I've got a page in here, questions I've received from other groups. I adjust this page for different groups I go on. So you might go through that at home. But these pages that follow are right off of the government website. This is public record, you can go on and learn this.
How is the government, go ahead, Charles, you've had your hand up all night, I'm sorry.
You said BJC hospitals are participating in.
No, they're not.
What
They're
about,
deemed too high.
what about the S?
No, it has nothing to do with their deemed too high.
That was just in the paper.
What about the SSM?
They're not joining either. That's their option.
So what
They
is-
cannot force a business to join this.
So what does that mean?
So you have it, you can't go to Barnes Hospital for care.
Right.
Or
Right.
St.
You
Mary?
can, but you're gonna pay out of it,
Network,
you're gonna pay out of network.
You could probably go to Chicago.
Go to Canada.
I have a question about the relationship between Obamacare and Medicare. When the law was passed, there was not enough money in the federal government, so the Democratic Party, which they had passed this law, went to the Medicare fund, and they got from there $716 billion. Now, that affects the longevity and the health of the Medicare program. My question is that money going to be paid by Obamacare to Medicare, so that Medicare?
No, the way our government works, they take money out, they never put it back. It's gone. They're not putting it back.
Now, the speculation is that if they paid it back, Medicare could be solvent until the year
You said if.
2024. Now that they are not going to pay it back, Medicare will become insolvent at the end of Obama's second term, 2016. Is that a correct assumption?
Pretty close. You know, they're spending money we don't have, and we've got a Federal Reserve that prints money, just, they've got a tree in their yard that they think that is made out of gold or something.
How is the government,
Right. Right, so subsidies, the next page, it tells you about subsidies. Who gets a subsidy? Up to $45,960. When this was originally copied off the website, I think it's now $44,000. I didn't look at it today.
So it changes every day?
Well, not every day, but they are making tweaks. There are a lot of things that have to be done. The brief that came out today, this afternoon, is right here. The premiums were submitted to the federal government. And in Missouri, the average premium for a 27-year-old for their gold plan, the federal government estimates the premium should be $242. I sell insurance now. For $242, somebody would almost be wiping that 27-year-old's butt at today's rates. A 27-year-old could get a plan that's a $3,000 deductible, 70% co-insurance for about $62 right now.
a month?
So the new rates are $242. That tells you.
They think those young people are gonna sign up.
That tells you how much the rates are going up.
Yeah.
But that's
Okay.
why the penalty is also as low as it is. because they know that people aren't gonna sign up, and they're gonna
Yeah,
run
right.
all the
To get
insurance
them
companies
suckered
out
in.
of business.
Okay.
And then come back in and say,
Right,
rules have all changed,
they're going to
everybody
change.
is screwed.
They've got this wonderful thing on the website that tells people what is gonna be counted as income.
Right.
And, you know, it includes their wages, salaries, tips, any self-employment or business, unemployment compensation, and social security payments. And then they go on and tell people, you don't have to figure out what your modified adjusted gross income all by yourself. The math will be done for you when you apply through the marketplace agency. When I completed the information just to be able to sell that, it was very financially intrusive. And what I had to answer was nothing as to what people, because I'm not looking for benefits. It's going to be different for people. When I finished my little testing, it came up, you have to verify your online person, who you are. Because they go to Equifax, they go to the IRS, so they access your past tax records, your credit records. A question came up for me, it says, oh, we see you had a mortgage in May of 2004. We show your mortgage is with such and such. And basically you have to say true or false. We see you have a credit card with so-and-so, with JCPenney, that you opened in whatever year. True or false. And so if you answer that wrong, then it doesn't validate your eligibility in the system. But the amount of information that they know about people is unreal. So in order to get these benefits from this marketplace, these people are going to have to answer a lot of questions. And they're going to answer so many, and then it's going to pop up and tell them things about them that they have to confirm. Yes?
Sorry to interrupt you, but last year on my W-2, due to Obamacare, I got a letter from my company. Now the company,
There's a
when
spot
you-
on your W-2 form now.
there's a new spot which they said was only federal collection reasons only.
Yep.
But most people, they work for a corporation or something, you pay, say, $6,000 a year in medical, the company matches that was, they're tracking now what the company's contribution level is.
Right.
And supposedly it has nothing to do with anything, is the letter that I got, but I'm afraid they're gonna put
It
that
does
in
have
as
something
income.
to do with it.
That's what I wanted to ask you, are they
It
gonna
has to
consider that
do with
income
it
now?
because they pushed the employer mandate off for a year because they knew that that would be a big, big problem. So they pushed it off for a year because under that employer mandate, if you had more than 50 employees, you had to give everybody insurance, and you could not charge them more than 9.5% of their wages for insurance. That was a big deal. And then also, if your insurance combined is called a Cadillac plan, and it's expensive, you are taxed on it.
As income, as
Yes,
if you receive.
but the problem with that is there are many people who have high insurance premiums. I have one client, I've had them for a long time, they're a sickly group, the whole group's sick. It's $1,700 a month for a single person there. The employer pays 100% of the insurance premiums for everybody. Well, I got them to do 95% because of different rules. They pay a chunk, but that puts them into the Cadillac insurance plan. You know, they have a $2,000 deductible. It's not a Cadillac benefit. It's not a 100% plan. They have a high out-of-pocket. They have high copays. But they've just had bad health history. And so if they don't change, they're going to be penalized as having a Cadillac plan. And they put that on your W-2 so that they could figure out who to tax.
Okay. Because they said this had nothing to do with it.
It does, but
So I figured
it
they
had
don't
nothing to do
collect
with it
data like
at
that
that
for no
particular
reason.
moment in time, but in the future it
In the
did.
future, right?
Enrollment starts the first, correct?
Yes.
How long is that period, that first enrollment period, before they consider you not to have signed up and start fining you?
The first initial open enrollment is for 6 months, October 1st to March 31st.
And how,
Next year, it will only be 3 months.
how are they going to track the people? How are they going to identify the people that don't sign up so they can find them?
Through the IRS.
F-I-N-E, not F-I-N-D, but
Right.
so they can find them.
It's going to be interesting, because there are some people that I don't think they're going to be able to find, because you
They
can't
don't
force
pay
somebody to
taxes.
file a tax paper. You know? But the thing is, you don't have to get insurance through the marketplace, but you only get a tax credit or subsidy at the marketplace.
Well, how much are they gonna fine them?
The first year is 1% of their income, or $95, whichever is greater. The second year, it's 2%. Third year, it's 2.5%.
Do they cap it?
No.
Keeps going up.
Which they
Oh,
won't
no, there is a
pay.
cap, I'm sorry, there is a
Which
cap
they
the
won't
first year.
pay, so you
I don't
can't
recall.
Which they won't
Blood
pay.
out
So
the
say
term.
I'm a 21-year-old college student putting myself through college because my parents can't help me. And, all of a sudden, you have to report this, and you just can't afford it. So then you just don't do it. And they can't,
Right,
they
but
can't.
most people think that tax refunds are a form of savings.
Right.
How many people do you talk to? I got back $2,000. Okay, so guess what? They're just not gonna get $2,000. They're gonna get $1,900 the first year, or whatever their penalty is. They can't, but if you have zero, they can't force you to pay it, but if you have money coming back, they can withhold it,
So there really isn't a penalty, theoretically.
theoretically.
I would like to answer that question raised here. How would they find out if you are cheating the system? Under the present system, there were 16,000 internal revenue service agents that were added to
Yes.
the Department of the Treasury. And these are the people, whether you call them spies or
Yeah, there are a lot of new people.
searchers, they will be around and they'll find you.
Yeah, because everybody's given a social security number at birth now. Remember, you didn't used to have to have a social security number until you were in your teen years or early
Typically
20s,
18.
when you started to work.
When I started working.
But our federal government needs those social security numbers as collateral for all these loans that we do. And as time has gone on, now you get a social security number issued to you before you come out of the hospital.
Right.
Because that allows them to borrow more money. They've got something to use as collateral. That social security number belongs to a person, and they're going to live, they're going to work, they're going to pay taxes, so that's a collateral for them.
You have a couple, 65 years old, or 64 years and 10 months old right now, married born on the same day, both working, and they both retire this year, and they go to Medicare. Are they going to be forced to take out this government insurance as their secondary or primary coverage, or are they just?
Oh, no. This is not, the marketplace is not secondary coverage. Not everybody can have marketplace plan. If you're eligible for Medicare, you're not getting a marketplace plan. If you're eligible for Medicaid, you're not eligible for the marketplace plan. They won't sell it to you.
Gotcha.
Some people, yeah,
How does a 30-year-old uninsured person know what to do?
Yeah, that's
they're just supposed to, the government passed it and they expect everybody to know
The
it.
facilitator's gonna help.
Navigator.
How do they even know?
Navigator.
So my point is, how do they even know where to go to find the information out? They're not coming to the town meetings like we are,
Healthcare.gov.
so they're expected to just know to go there.
Well, any legitimate
It'll be on
independent
TV.
agent like
It
you,
won't be on.
anywhere in the country,
Yeah.
ought to be able to answer these questions for these young uninsured people.
They gotta know who to go call them though.
You go to the insurance agent.
Yeah, always go to an insurance
Go to
agent.
Robin.
If your insurance agent, if you don't know who your insurance agent is, find out. If you buy your insurance individually, ask your insurance agent if they, just flat out ask them, are you a Republican or a Democrat?
Really? I like it. Go ahead.
And I'm Republican.
Insurance agent.
I have a question. What about, when my husband works and we get covered by Aetna, so I'm sure some people are in the same boat. Like, is something gonna change October 1st?
You can go onto Aetna's website and they will tell you about the changes that are happening to your plan. They will not happen There are many employers whose plans are not going to change because all of the insurance carriers are offering small businesses and individuals to change their renewal date to November or December 1. What that will essentially do, it will guarantee that you keep the same benefits you have through next November 30th. That way, while everybody else is scrambling, you can be assured that you've got coverage while they're working out all the bugs, the chips are falling, and we see what it's gonna cost. At renewal, 1 year from now, people are not gonna be happy when they find out what it costs, because taxes are gonna go up, premiums are going to skyrocket. And they won't be able to skyrocket in the private sector as much as they do in the marketplace. They're going to go up in the private sector because everybody has to be accepted by every carrier with no pre-existing conditions. The only thing they're gonna ask you anymore, your name, your social security number, your home zip code, and what's your income. They don't care if you're male or female, they don't care if you're tall or short, they don't care if you're skinny or fat, they don't care if you're scheduled for a heart transplant next week. Well, they do care, but they cannot ask that.
And that's if you're a smoker or not a smoker?
Nope. Oh, yeah, they can do smoking. They haven't defined what smoking they're talking about. If they're talking about cigars, cigarettes, pot.
Necessary, now come on.
This information that every business has to give to their employees by October 1st,
Yes.
what is that?
That is mandated by the federal government that small businesses are going to tell their employees about the new insurance company on the block, the marketplace. And small businesses are required to do this at their own expense. And they have to give this piece of paper to you that tells the employer's name, address, their federal tax ID number, who the contact person is there, what kind of health insurance plan they have, if it covers essential benefits, if it is cost effective for you, and so forth. Because you need that if you decide to buy insurance at the marketplace.
And this is for all organizations. I understand that charity.
There is, but there's no penalty for not doing it.
Oh.
And it's regardless of the number of employees that's.
Yes, that has to be given to every employee, full-time, part-time, seasonal, everything.
You know, when you read about this, the cost it's actually gonna cost the taxpayer, the citizen, it's all over the map. Can you recommend a source that you use to get some kind of accurate cost, what it's gonna cost?
Oh, come on, we don't need that.
I can tell you October
We can
1st.
go all night.
But there's no website you recommend or any?
Yeah, there's a page on, Forbes has got a page up that shows the premiums, and I've been waiting for the update, but this came out today from Health and Human Services. And it
No, they
has.
said it looks good, Health and Human Services, it looks good, everybody else is.
Oh, yeah, they've got, it doesn't look quite as good as, but they keep trying to pump it up. But even their own information is starting to look, and I can give you, you can email me and I can give you the website where I got this
Okay.
from the government. So.
Is your email on here?
Yeah, the very last page should have, oh, it doesn't have my email on there, but I've got a business card with me and I will give it to you. And you can email me and ask any questions, or you can just type my name in the internet and I will pop up.
Another thing, you brought up that percentage a little bit ago, about 9.5%, they couldn't charge more than that for an employee. From what I understand, I've been reading, that's why all these companies are dropping spouses and kids.
Because spouses are not considered dependents
Yeah.
under the Affordable Care
So
Act.
all of a
only
sudden, people are
children.
getting notices that,
No
even though
spouses.
before they were paying for their entire family, because the people that came up with that percent didn't come into consideration that they were covering the entire family.
It's considered the family glitch,
Yeah.
and they're
Like
addressing it.
Home Depot just announced they're dropping all spouses and kids,
Mhm.
because they didn't take that into consideration.
Several companies have already.
Yeah.
Yes.
So hopefully this helped everybody out a little bit. to
You've been
learn more
very
about
good.
it.
Yeah, thank you.
Everybody wants my card, yeah.
And people, we saw some new faces, make sure we get your email, because Teresa, our committee woman, plans wonderful meetings, and we'd like for you to come back.
I already did.